Good day and welcome to the virtual pressure of the results of the third run of the NCR COVID-19 panel survey. I am Etienne Benipayo of the Government Relations Unit of Publicus Asia, and I would be your moderator for today. Let me introduce to you the team who will be with you today. Joining us is the COO and acting CEO of Publicus Asia, Ms. Lilibet Amatong, and our Executive Director, Mr. Aureli Sisinsuat. To give a background of what we do in Publicus Asia, I now turn over the screen to Miss Lilibet Amatong. Miss Bet.
Thank you, Benny. Good morning, everyone. Once again, welcome to Publicus Virtual Presser on NCR COVID-19. This is our last run for NCR. This is an online panel survey powered by Vox Opinion Research, the research arm of Publicus, in partnership with Lightspeed, Asia Pacific Regional Headquarters of Rantar, which is the leading firm in the global data industry with a reach of 88 million respondents in 90 markets worldwide. Debate has been going on to whether or not ECQ be lifted, particularly in Metro Manila. A lot of us are still worried as to whether we have indeed flattened the curve. That is, whether the number of COVID-19 cases recorded every day has been contained enough to warrant announcing GCQ in lieu of ECQ. And so we can resume some economic activities. On the other hand, some of us are concerned about prematurely lifting ECQ and allowing people to go back to work because this move could possibly lead to a worse second COVID-19 wave. This last run of online panel gives you three takeaways. One, that the disapproval of the DSWD's implementation of the social amelioration program is growing. Two, that there is a high disapproval on the aid given by Chinese government to the Philippines in its fight against COVID-19. And three, that the respondents have overwhelming support to continue ECQ practices such as mandatory face masks in public, physical distancing, ban on mass gatherings, and curfews, even when ECQ is lifted in favor of GCQ. Our Executive Director, Aureli Sinswat, will tell you more on the juicier details. And should you have questions, I would encourage you to use the buttons of the box on the Q&A. And Benny will moderate the flow of the Q&A towards the end of this presentation. So without further ado, back to you, Benny.
Thank you very much, Miss Amatong. Today's virtual pressure will cover the short details. Will cover some details of the virtual pressure, including the living standards during the ECQ and the approval rating of local chief executives in the NCR. To give more to give a more extensive explanation on the results of the third run, and I'll turn over the screen to Mr. Aureli Sisinsuwat. To our friends in the media and our viewers today, you may send in your questions as mentioned by Ms. Amata on the Facebook comment page and in the Viber group. Sir Aureli.
Okay, thank you, Benny, and thank you also, Ma'am Bet, for that wonderful introduction to provide context. I just would like to note before I start in the going into the results that this is the third and final run of the NCR COVID-19 online panel survey. And personally, on behalf of Publicus, I hope that we have achieved our primary aim, which is to provide timely and reliable, actionable information to public officials, civil servants, the media, and the people at large on public opinion and perceptions relating to the COVID-19 pandemic. As we've explained before, our reliance on an online panel and purposive sampling for the COVID-19 survey was born out of the necessity to innovate in the face of the novel logistical challenges posed by this novel coronavirus, which ultimately made face-to-face surveys impossible during the duration of the enhanced community quarantine. Truth be told, the Philippine polling industry is several years behind the United States and other industries abroad that already rely on the online panel as a primary source of data for political surveys. We hope that the NCR COVID-19 online panel survey will help mainstream the use of panel surveys in political and social research in the Philippines, as this will allow for the faster reporting of survey data with significantly reduced operating expenses. Of course, this doesn't mean that Publicus will not continue to conduct traditional face-to-face surveys using the computer-assisted personal interview or CAPI method. Of course, we will still be conducting regional and national surveys using both traditional and online methods in the coming months. So stay tuned as we enable the reality of a more responsive, innovative, and inclusive public opinion research climate in the Philippines. So about the survey itself, um, as mentioned before, this is an independent non-commissioned tracking survey with 1,000 respondents aged 18 to 70 and residing in Metro Manila. The field work of the survey was conducted between May 5 to 8, 2020. The first and second runs will be mentioned often comparatively. So we should note that the first run was between April 2 to 6, and the second run was between April 13 and 18. So without further ado, let's just move straight into the panel demographics of our third run of the survey. So regarding the age, again, as with the first two surveys, the panel is relatively young, with 4 out of 5 respondents below the age of 40. Specifically, 50.6% of respondents are between the ages of 18 and 29, and another 30.7% are aged 30 to 39. Meanwhile, 12.4% of the panelists are aged 40 to 50 to 49. 5% of the panelists are between the ages of 50 and 59, and the remaining 1.3% are between 60 to 69 years old. Regarding the city or municipality of residence, we use the same quotas as in the first two surveys. Again, Quezon City, Manila, and Caloocan have relatively large samples due to their high proportion of the total number of Metro Manila residents, and Pateros and San Juan and Navotas had relatively smaller samples. For household size, most respondents live in a typical household with 3 to 5 members. More than 1/3 of the panel, or 37.1%, live in large households with 6 or more members, and only 7% live alone or with just one other person. Now, for household income, we can see here that more than 1/3 of our respondents, 35.7%, live in poor or low-income households earning 19,040 pesos per month or less. More than 1/4 of the panel, or 26.2%, live in lower middle income households earning between 19,000 and 38,000 per month. 18.5% live in middle class households earning between 38,000 and 66,640 per month. And the remaining 14.4% live in upper income, or rich households earning more than 66,640 pesos per month. Again, we've added a comparison of the demographics in terms of income bracket of our survey compared to the 2015 Family Income and Expenditure Survey, or FICE, of the Philippine Statistics Authority. And while we can see that there are some differences, our survey has a good mix of respondents from various income backgrounds. I would like to highlight especially that the poor are significantly overrepresented in our survey by more than 100%, there being 11.4% of our respondents coming from the lowest income brackets. And for gender, as with our other surveys, the panel has a significantly higher proportion of females, 62.6%. So now we move on to living standards. And family condition during the ECQ. A plurality of respondents indicated that the status of their families under the ECQ is either good or very good. 36% said the status of their family is neither good nor bad, and a little over 19% of respondents said the status of their family under the ECQ is bad or very bad. The results here suggest that the overall condition of some families may have improved since mid-April. Good and very good family condition has increased by 4.9% compared to the April 13 to 18 run of the survey. However, it should be noted that there has been a marginal increase as well in the proportion of bad or very bad family condition responses, which increased by 0.6%, under 1%. Again, however, we note that a common thread that we've seen throughout all three runs of the survey, which is that respondents from lower income groups recorded significantly higher incidences of bad or very bad family conditions. In this survey, it was the two lowest income groups that recorded higher incidences above the 19.3% average. Exactly one third or 33.3% of respondents from poor households reported bad or very bad conditions for their families, as well as 22% of respondents from low income households. An interesting point here is that the third highest incidence of bad or very bad family conditions were actually reported by respondents from the upper income or the second highest income classification at 18.51%. Moving on to the supply of household necessities, 55% of respondents said their households have enough food and water to last them for only 1 week or less. This result suggests a relatively less sufficient food and water supply among the panel population compared to the second run of the survey from April 13 to 18, when only 52.6% of respondents said that their food and water supply was only good for 1 week or less. Regarding money supply, more than half of respondents, or 53.8%, said their households have enough money for only 1 week or less. This result also suggests a dwindling supply of money among the panel population compared to the second survey run, when 50.5% of respondents said their households only have enough money for 1 week or less. 58.5% of respondents said their household supply of medicine was only enough for 1 week or less. This 2.5% increase reporting medicine supplies sufficient for 1 week or less again suggests that medicine supplies are also dwindling among the panel population. Just to recap, among our panel population, it appears that household supplies of food and water, money, and medicine are all dwindling as the duration of the ECQ continues. Moving on to loss of employment under the ECQ, 69.2% of respondents reported that at least one member of their respective household who was employed before the ECQ has lost his or her job due to the ECQ. This is a 5.2% increase from the April 13 to 18 survey, when 64% of respondents reported job loss in their household. The data suggests that incidents of unemployment caused by the ECQ may be growing among panel households as the duration of the ECQ continues to extend. The data also suggests that panel households from lower income brackets may be significantly more likely to experience job loss due to the ECQ compared to more affluent panel households. We can see here on the slide that 80.7% of respondents from poor households and 81.48% of respondents from low income households reported that at least one member of their household had lost their job due to the ECQ. Generally, the proportion of respondents who reported job loss in their household decreases as monthly household income increases. up to the point where only 25% of respondents from rich households indicated that someone from their household is now unemployed due to the ECQ. Now we move on to the second section of our report, which is national government perceptions. First, confidence in the national government's ability to contain COVID-19. 42% of respondents think that there is only a 50-50 chance that the national government will be able to contain and prevent the spread of COVID-19. This was the highest proportion of respondents. Meanwhile, 33.9% answered that there is a high or very high chance that the national government will succeed in containing the pandemic. 23.7% had a low or very low confidence in the government's ability to prevent the spread of COVID-19. These data indicate a 5% increase in respondents with low or very low confidence, and a 6.1% decrease in high or very high confidence between the first to the third runs of the survey. This suggests that overall confidence in the government's ability to contain the spread of COVID-19 may actually be decreasing over time within the panel population. Next, we move to the approval of the Duterte administration. More than 2/3 of respondents, or 67.8%, approve or strongly approve of the manner in which President Rodrigo Duterte and the national government are responding to the COVID-19 pandemic. 17% neither approve nor disapprove, while 15.2% either disapprove or strongly disapprove. The results from the third run of the survey indicate a marginal 1.9% decrease in approval of the Duterte administration's COVID-19 response compared to the April 13 to 18 run of the survey. However, we should note that the 67.8% approval rating is still higher than the low of 66.6% recorded during the first run of the survey from April 2 to 6. When we look at the approval of the Duterte administration response to COVID-19 by income, we can see that approval was particularly strong among respondents from households classified as low income at 80%, and also among the poor at 72%. However, approval was weak or below average among respondents from households classified as upper income, only 52%, upper middle income, 55%, rich, 62.5%, middle income, 64%, and lower middle income at 65%. When we look at the approval numbers by age, meanwhile, we'll also see that approval was quite low among younger respondents. Only 58% of respondents aged between 18 and 29 approved of the Duterte and national government response to COVID-19. However, approval among respondents between the ages of 30 to 50 was significantly above average, hovering just below the 80% mark. Concerning the interagency task force on emerging infectious diseases, we see here that more than 60% of respondents, or almost 61%, approve or strongly approve of the IATF EID's response to COVID-19. 28.1% neither approve nor disapprove, 11% disapprove or strongly disapprove. These results indicate a 1.2% increase in approval and 2.7% decrease in disapproval compared to the April 13 to 18 survey. Meanwhile, 55.5% of respondents approve or strongly disapprove of the Department of Health's response to COVID-19. 25.5% neither approve nor disapprove, while 19% approve or strongly disapprove. These results indicate a 4.2% increase in approval from the April 13 to 18 run, as well as a 2.1% decrease in disapproval. As mentioned by Ma'am Lilibet in her introduction, we see growing dissatisfaction among the panel population regarding the Department of Social Welfare and Development's implementation of the Social Amelioration Program, or the SAP. The highest proportion of respondents, or 43.5% of respondents, disapprove or strongly disapprove of the DSWD's implementation of the SAP. 30% approve or strongly approve, while 36.5% neither approve nor disapprove. These results reflect a 6.8% increase in disapproval and a 3.2% decrease in approval compared to the April 13 to 18 survey. Overall, these results suggest deteriorating perceptions among the panel population on the performance of DSWD. Next, we asked respondents what their preferred form of assistance from the national government would be. We changed this question compared to the first and second survey runs in that before, respondents could vote for any of the 4 options, but this time we asked them to only choose one. Among food and water, medicine, money, and testing kits, money is the preferred form of COVID-19 assistance that respondents wish to receive from the national government at 62.7%. This is followed by a close second, or not a close second, a distant second place rather, by food and water at only 18.6%. So basically, respondents would really prefer to receive money from the national government as assistance due to COVID. Moving on to the comparative performance of the Philippines compared to other countries battling COVID-19. When asked to rate the Philippines' performance in responding to COVID-19 compared to other countries, 45.8% of respondents said the country's performance was average. Almost 1/3, or 31.9% of respondents said the Philippines' performance was below average or far below average. Only 22.3% of respondents said the country's performance was above average or far above average. Next, regarding the approval of information communications technology use against COVID-19, 68.9% of respondents said they approve or strongly approve of the national government's use of internet and internet-based technologies in responding to the COVID-19 pandemic. 22% said they neither approve nor disapprove, while the remaining 9.1% either approve or strongly disapprove. So next, we move on to the local government perceptions. First, a new question for the third run of the survey. Since some areas in the Philippines are starting to move towards transitioning away to ECQ and towards GCQ, or even a complete lifting of quarantine policies, we added several questions in the third run of the survey which talk about, or which gauge the perceptions of respondents about what happens next after the ECQ. So first, we have here confidence in mayor and LGU abilities. And by the way, when we say after the ECQ, this means that the ECQ has been lifted and we have either transitioned to a GCQ or no quarantine policy at all. So we asked respondents how confident they are in their respective mayors and city governments' ability to effectively manage COVID-19 in their cities once the ECQ is lifted in favor of GCQ. A majority of respondents, 52.4%, said they are confident in their mayor and city government capabilities. However, when we asked them if they were confident specifically in the mayor and LGU's ability to manage the peace and order situation post-ECQ, after ECQ, during GCQ, the highest proportion of respondents, at 40%, said there is only a 50-50 chance that their respective mayors and city governments would be able to maintain peace and order upon lifting of ECQ and its replacement with GCQ. Excuse me. We move now to mayor and LGU approval. First, we talk about the overall approval among all respondents. Almost half of all respondents, or 49.6%, approve or strongly approve of the responses of their respective mayors and city governments to the COVID-19 pandemic. 26.8% approve or disapprove or strongly disapprove of the performance of their mayor and LGU, while 23.6% neither approve nor disapprove. When we look at the comparative data from the first, second, and third runs of the survey, the data suggests a significant increase in mayor and LGU approval among the panel population. Approval increased by 5.9% compared to the April 13 to 18 run, while disapproval decreased by 6.4%. Now moving on to the mayor LGU approval per city and municipality, the number one spot is taken by Valenzuela City. 92% of respondents residing in Valenzuela City approve of their mayor and LGU response. This is the highest approval rating among in the May survey and the top overall approval rating among all mayors and LGUs across all three survey runs. In respondents from Pasig at 83%, Manila at 76%, Marikina at 68.58%, and Taguig at 68.25%, round out the top five in terms of highest major mayor and LGU approval. Again, we reiterate that we do not write the names of the mayors in the questionnaire, it's the city there. But however, we would like to note that the mayors of the top five cities are Mayor Rex Gatchalian from Valenzuela City, Mayor Vico Soto from Pasig, Mayor Isko Moreno Domagoso from Manila, Mayor Marcy Teodoro from Marikina, and Mayor Lino Cayetano from the city of Taguig. Moving on to assistance already received, 91.3% of respondents have already received food and relief packs from their respective LGUs. Meanwhile, 21.5% have received financial assistance or money from their respective LGUs. These results suggest an increase in the percentage of panel households receiving relief from LGUs since the April 13 to 18 survey, when only 84% had received food packs and only 20.8% had received financial assistance. In particular, we can see here that efficiency in the delivery of food and relief packs have significantly increased between the April 13 to 18 survey and our May 5 to 8 survey. When it comes to the preferred assistance from local government, money is now the preferred form of assistance from LGUs at 48.2%, followed by food and water at 39% of respondents. We note here that in the first two surveys, food and water was the form of assistance most desired to be received by respondents from LGUs, but now it's money. Moving on to LGU use of information communications technology, 67.5% of respondents said they approve or strongly approve of their local government's use of internet and internet-based technologies in responding to the COVID-19 pandemic. 21.8% said they neither approve nor disapprove, while the remaining 18.7% either approve or strongly disapprove. So we move on to the next section now, which is perceptions on media and foreign institutions. First, the volume of fake news during the ECQ. Respondents were divided on whether the volume of fake news had increased or decreased during the ECQ. The highest proportion of respondents at 33.7% said the volume of fake news had decreased a little or a lot compared to before the ECQ. Another 33.4% said fake news had increased a little or a lot, and 32.9% said the volume of fake news during the ECQ was more or less the same. Next, we go to trust rating of media during the ECQ. A majority of respondents, or 51.4%, answered that their trust in media was more or less the same. during the ECQ compared to before. Another almost 30% said their trust in media had actually increased a little or a lot during the ECQ, while almost 19% said their trust had decreased either a little or a lot. Next, we move to the approval of COVID-19 aid provided by foreign countries and organizations. This was mentioned as one of the three main takeaways by Ma'am Lilibet in her introduction. We can see here on the slide that generally respondents approved most of the aid provided by the East Asian nations to the Philippines in its fight against COVID-19, with the marked exception of China. More than 3/4 or 76.7% of respondents approved of the aid provided by Japan, while 72.7% approved of the aid provided by South Korea. And Taiwan also had a high approval rating at around 65%. These approval ratings were higher than the US and the European Union, but we can see here on the chart that even the EU and the US had majority approval among respondents. However, only 33.9% of respondents, or 34%, approved of the aid provided by China, while 37.4% disapproved. The 37.4% disapproval rating for COVID aid provided by China is the highest disapproval rating among all countries tested by more than 25 points. Next, moving to our final section, perceptions on COVID-19 policies. We see here that the approval of the Metro Manila ECQ is 85%. This is a small increase from the 0.8% from the April 13 to 18 survey. I would like to note also that we will see this as a common thread between the various questions about the ECQ. Respondents from poor households registered the lowest approval among the all income groups of the ECQ at 72.81%. Regarding the approval of the extension, the original extension of the ECQ to May 15, 78.3% of respondents approved or strongly approved of that first extension. Again, we see here that respondents from poor households registered the lowest approval for the extension among all income groups at 66.67%. Meanwhile, respondents from upper middle income and upper income households registered the highest approval for the extension among all income groups at 88 and 85% respectively. Now, regarding the ECQ extension beyond May 15, 2020, we should note that during the fieldwork of this survey from May 5 to 8, there was no decision yet on the extension of the ECQ beyond May 15, but it appears that the ECQ will be extended in Metro Manila until at least May 30, 2020. As we reported a few days ago, 73% of respondents approve of extending the ECQ in Metro Manila beyond May 15, 2020. The lowest approval rating by income group were registered among respondents from households classified as rich, 62.5%, that's the highest income bracket. Poor, the lowest income bracket, at 64%, and upper income at 66.67%. Meanwhile, significantly above average approval ratings were observed among respondents from households classified as upper middle income at 78% and middle income at 76%. I would like to note again that based on the data from the last 3 slides, we can see that poor respondents or respondents from households classified as poor seem to approve of the disapprove or approve of the ECQ and its extension at lower numbers compared to other income groups. Moving on to a new question here, we asked respondents which leader and institution is most responsible for containing COVID-19 during and after the ECQ. So when we say during the ECQ, this would mean since mid-April, or since the ECQ started in mid-March until whenever the ECQ might end in Metro Manila, either May 30 or perhaps even after that. And then after ECQ is when Metro Manila transitions to GCQ. Now, when we're talking about during the duration of the ECQ, a plurality of respondents, or 42%, answered that their respective mayors and LGUs are the leader and institution most responsible for containing the spread of COVID-19. However, when the ECQ ends, it appears that the highest proportion of respondents at 46.2% answered that President Duterte and the national government are the leader and institution most responsible for containing COVID-19. Essentially, we can see here that respondents, based on the perception of respondents, the mayor and LGU are the most responsible during the ECQ. But after the ECQ, the buck is passed to President Duterte and the national government in terms of containing COVID-19. Next, we asked respondents about their level of understanding of the differences between the ECQ and GCQ. The majority of respondents at 69% said they understand a lot of the differences between the ECQ and the GCQ. 28.6% said they understand the differences a bit, and only 23% said they do not understand the differences at all. Next, the perceived frequency of ECQ violations in barangay. We asked respondents how many incidences of ECQ violations did they hear about in their barangays during a week. The highest proportion of respondents said there were between 1 to 5 violations that they heard of per week. That's almost half of them at 44.9%. Next, the third main takeaway mentioned by Ma'am Lilibet in her introduction is the perceptions on the continuation of ECQ policies during the GCQ. We asked respondents what should happen to 4 main ECQ policies once the ECQ ends and Metro Manila is put under GCQ. These are the mandatory wearing of face masks in public places, social distancing, a ban on mass gatherings, and curfew hours. For all 4 policies, an overwhelming majority of respondents approved of their continuation after the ECQ ends and we transitioned into the GCQ. Essentially, this means that 90% of respondents support mandatory wearing a face mask in public places after the ECQ. 85% support physical distancing after ECQ. Almost 80% support a ban on mass gatherings after ECQ. And 76.4% also support the imposition of curfew hours even under the GCQ. Next, we move on to mass testing versus targeted testing. Again, the question here is we try to make this question not loaded. We ask them, respondents, how the government should implement its testing regime. And then the 3 responses are mass testing, including those without COVID-19 symptoms, targeted testing only for people without COVID-19 symptoms, and I do not approve of wider testing for COVID-19. So in the third run of the survey, more than 3/4 of respondents, or 76.9%, want the government to conduct mass testing, which includes people without COVID-19 symptoms. 22.1% would prefer the government conduct targeted testing of people with COVID-19 symptoms, and 1% of respondents do not want the government to conduct expanded testing at all. The 8.6% increase in support for mass testing between the April 13 to 18 and May 5 to 8 runs of the survey suggests that support for mass testing may be growing among the panel population. And finally, to our last point, the approval of other existing and proposed COVID policies. This list has grown with every survey run that we've had. And in the third and final run of the survey, we tested 12 additional policies. Respondents overwhelmingly approved of 11 of them. A common factor that we've seen here throughout all surveys is that the most highly approved policy was providing frontline medical service people, so doctors, nurses, med techs, etc., with additional pay. This has been the most highly approved policy in all surveys, as it was in the third round of the survey with 96.3%. Other than this, I would like to highlight just 3 other policies that we tested. There are 2 new policies that we tested, which have been talked about by policymakers and also netizens, and these issues have been in the news in the recent days and weeks. The first is the idea of keeping senior citizens under quarantine even after the lifting of the ECQ. There has been some discussions of not allowing senior citizens out of the house during GCQ because they are at high risk of contracting COVID-19. We saw overwhelming support for this policy among our respondents at 86.3%. Also, there have been talks of reopening the economy in multiple phases, wherein some sectors will be allowed to open while other sectors will be kept shut down. So this multi-phased reopening of the economy also had high approval at 86%. And lastly, the only policy for the third straight time, which did not garner majority support from our respondents, was providing big businesses with financial support. However, I would like to note that the 48.5% approval for this policy is a 5% increase in support compared to the April 13th, 18th survey. So with that, thank you for bearing with me through our report. I apologize, it was a bit longer than the first 2 because we lengthened the questionnaire here. But again, thank you very much for tuning in with us, and I'm ready to answer your questions, if any.
Thank you very much and well explained, Mr. Sensuat. Okay, our first question for the answer and portion. Question and answer portion is, how does the level of approval and disapproval to the manner in which the DSWD has implemented the SAP could change the qualification and system of distribution?
Based on our data and based on what we've been reading in the media as well about, there have been a lot of criticisms levied against the DSWD about their implementation of the social amelioration program. We should expect, and DSWD should really work, streamline their distribution of financial assistance to families. We've been seeing in the media that because the disbursement of funds has been delayed, we've been seeing large crowds of citizens at the distribution point. So essentially, it defeats the entire purpose of the ECQ and social distancing when all these people have to come together at this one time slot in this one place to get the aid that they need to survive during the ECQ. So in terms of how the distribution is happening, we should expect the DSWD to be more efficient on this. And also, we should expect them to really give in to the public clamor and expand the number of beneficiaries for the social amelioration program. We've seen here, the data has shown here that the family condition, the sufficiency of food and water and money and medicine, all of these factors seem to be deteriorating for our panel households as the ECQ goes on. And now that the ECQ has been extended once again for an additional 15 days at the very least, the DSWD should be sensitive about this, about the plight of our countrymen here in Metro Manila, and really work to increase the benefits and the scope and the coverage of their SAP.
Next question from Sabrina de Guzman on Facebook. In your survey, the approval for IATF and DOH has increased, but the President and DSWD dropped. And is SAP here a big difference? And what is the reason for the two of them when it comes down?
In terms of the drop of the presidential approval, it's a fairly marginal decrease of less than 2%, and it's actually higher than the first approval rating of 66.6% in the first survey. So when we look at it in the context of, again, this is a tracking survey, so we're looking at how the perception of the people change over time. It's actually, there's little, if any, change, because the first survey was 66.6% approval for the Duterte administration. The second survey was almost 70%, 69.8%. And now we see here around 68%. So I would interpret these as being more or less consistent approval for the administration within the high upper 60s. Now, regarding the SAP, I would say that you are correct. That is a significant decrease. And the data are reflecting what we have been hearing in the news about the troubles that DSWD has had, and how the troubles that LGUs and our citizens have also had in working with DSWD to make sure that the SAP funds are distributed as necessary. In particular, LGUs have been really complaining about how the SAP is being, how the SAP is being implemented, because their constituents are going to the LGU and asking for help when it is not really even the LGU's program to begin with. Regarding the Department of Health, the data also suggests a strong increase in approval. This could be tied to the increasing amount of tests run per day, and also in general, a shift in tone from the Department of Health, focusing more on really ramping up the testing capabilities of the government. Regarding the IATF, EID, the increase was only marginal, so it's better to interpret that as a continuously consistent, strong approval for the IATF EID.
From Bernadette Alonzo on Facebook. 69.2 job loss under ECQ. Could this mean that further extension of the ECQ would lead to more jobs being lost in the process? What can the administration do about it, and what could the LGUs do differently?
Yes, the data show that indeed it is very possible, due to the ECQ, could grow even more over time. As we've seen here in the first survey, it was 64%, and in the second survey, it was 69.2%. So it could even go to 70% or above in future surveys if the ECQ continues. And this is why it is very important for the DSWD to implement its social amelioration program as much as possible.
we've seen in particular that poor and lower income households are experiencing extremely high uh, percentages of job loss in their households. This the DSWD needs to come to the support of these households which are losing their sources of income. Now, regarding LGUs, LGUs can also provide financial assistance, but I think more than that, what LGUs can really do is beat COVID-19 in their jurisdictions. Because again, the ECQ is something that is implemented when there is a high incidence of cases in a particular locality. And based on the announcement of the president earlier, we are scaling down our use of the ECQ to just really the greater Metro Manila area now. So we need to beat COVID in the NCR and in these outlying areas, because that's the only way that we can really open up the economy again and create jobs for these people who have lost their jobs, or allow these people to return to the jobs which will be opened again in the multi-phase opening of the economic sector.
Thank you, Mr. Shinsuot. From Glenn Enriquez on Zoom, the data shows a high report on the good and very good condition of families, but the supply of household necessities would only last for more than oh, supply of household necessities would only last a week for more than 50%. Does this mean that the respondents trust enough the government and the LGUs that they will provide for the need of the people?
I think in terms of especially food and water, yes, the people seem to trust the LGUs in particular. We saw in our data here that 91% of respondents have received food or relief packs from their local government units. That's 9 out of every 10 respondents. And take note, a good proportion of our respondents also come from upper middle class, upper income, or even rich demographics. And yet it seems that some of them at least have also received relief packs from the government, and especially the LGUs. So this is promising. This means that the LGUs are performing their what they need to do in terms of providing food and water. However, again, when it comes to money, we go back again to what we've been discussing with the DSWD. The money supply is dwindling with as time goes on in the ECQ. And so the DSWD really needs to step up and earn the trust of the people, because we see compared to the other agencies, the DSWD had the highest disapproval among all of them. So they need to earn the trust of the respondents and of the people of Metro Manila and in the country by effectively and efficiently implementing the social amelioration program.
Overall, what factors influence the public's perception on the transition from ECQ to GCQ? What does transition mean to the respondents in general?
Well, I think, to be honest, a transition from ECQ to GCQ would be like a breath of fresh air to many of us. We've been living under the restrictive but necessary policies of the ECQ for 2 months now. So I think for many, it will be nice to be living under less strict or less draconian quarantine policies. However, at the same time, when we transition to the GCQ, we have to remember that the fight for against COVID-19 is far from over at that point. Again, when we lift the ECQ in favor of GCQ, this means that GCQ areas are maybe moderate risk areas that or low to moderate risk areas, but that doesn't mean that the risk of contracting COVID-19 is zero. So when we see here in the ECQ, when we look at the data, most respondents, or almost half of respondents, heard that there were at least 1 to 5. They heard of at least 1 to 5 ECQ violations in their barangay per week. What more if it's the less stringent GCQ, right? So for those areas especially that are moving to GCQ from ECQ, I think the government needs to communicate clearly what exactly is the difference between ECQ and GCQ, what people can do and cannot do. And also, citizens really need to take the time to study what the GCQ rules are so that they will be able to follow and do their part in our combined national collective effort to beat COVID-19.
It was mentioned in the survey that the level of approval and the level of disapproval and level of approval and disapproval to the manner in which the mayor per cities are responding to the COVID-19 pandemic. Can it change the course? Can the LGUs change the course of these perceptions based on the service to their constituents?
Well, yes, the data are reflective of what we've been seeing on social media and hearing in the news about these mayors, particularly the high performing mayors. And we've seen a lot of fluctuation actually in the approval and disapproval of specific mayors and LGUs from one survey to another. We've seen jumps in approval and disapproval. I've seen a disapproval jump as high as 40 or 50 points and then go back down on the next survey. So we can see that the constituents, the Metro Manila constituents, are quite sensitive to what their mayors and LGUs are doing. And again, we see here in the data that the the leader and institution which respondents felt were most responsible for containing the COVID-19 pandemic during the ECQ during this time are the mayor and LGU. So the respondents themselves realize and note how important the work of the mayor and the city and governments are in containing COVID-19. So again, I think the data show that the respondents are quite sensitive to what the LGUs and mayors are doing, and so the mayors and LGUs can really influence public opinion by simply performing much better.
Okay, Mr. Sensuat, I think we have time for one last question. The survey has included the LGU's ability to maintain peace and order. Does this mean that there are implied peace and order issues during the ECQ and that there are projected peace and order issues after the lift on the ECQ?
Oh, certainly there are peace and order considerations, especially during the ECQ. After all, these are the ECQ policies like the curfew and the not allowing, cutting off, really locking down certain barangays or certain cities. All of these policies are really very restrictive. And also, we have to take note that these policies have caused people to lose their jobs, to lose livelihood. So when you put together those restrictions and when we talk about losing livelihood or deteriorating family conditions, things like that, there is a very real danger that citizens could riot, or if not riot, then at least they could get a little unruly within their barangays. Now, under the GCQ, the the GCQ provides a more stable atmosphere, but also could foster even greater public order concerns. Why is this? Because because the GCQ has less restrictive policies than the ECQ. It's lower down on on the latter in terms of strictness. However, the laxness of the GCQ could in itself foster a lot more unrest. Basically, lalakas yung loob ng mga gustong lumabag sa GCQ rules. And with the laxer enforcement and the laxer policies, we could see some peace and order concerns, which is why it is still important for, of course, for our local government and police force to strictly but fairly and even-handedly implement these quarantine policies. And at the same time, the residents really need to study what the differences in the rules are so that they know what they can and can't do when we transition from ECQ to GCQ. Essentially, it's a shared responsibility of both the government and our citizens.
Well said, Mr. Sinsuat. Again, we thank everyone who sent in and participated through Facebook and Zoom. And we thank everyone who listened and tuned in to us for our third and last virtual presser on the results of the NCR COVID-19 panel survey. To be updated with our reports such as this and other releases by Publicus Asia and Vox, do follow us on Facebook and Twitter at handle at Publicus Asia. Do follow us do follow our website and visit our website at www.publicusasia.com. And we hope for everyone's safety and liftment of the ECK soon. Thank you very much, Miss Amatong, Mr. Sinsuat, and everyone. Have a great day.